This one is a bit of a tricky literature to find. There's not too much research out there in terms of travel complications, but still an important topic. I was actually able to find there was a textbook that had a chapter in it that was related to team travel with sports. So not necessarily the most evidence-based practice from this approach, but do my best to kind of piece together those things. So brief overview for the week. This is the last week in April, and April was the acute injury month. So the subtopic for the week is travel complications, things that you have to deal with on the road that you might not have to if you're hosting. So the first couple things that come to mind for me, and again, this is not necessarily evidence-based. This is just the way that I conceptualize things. The legislation piece, so crossing state borders, or in soccer, or in Dave's case, basketball, you might have some international travel. So paying attention to the different legislation, things that apply intrastate or international. So sometimes states will allow practices for athletic trainers, whereas they might not in others. Being aware, being mindful of the different practices that you can and cannot implement, things that you may need supervision of your team physician for. And then in terms of the resources, there's differences in the staff that travels, but then also the equipment that travels. So as Dave touched on, the staff, when you're in the soccer world and you've got a full team of medical staff, it's a bit different than if you're just a one-man show and you're in charge of everything. EAPs are obviously a bit different. You're not the one writing them. You haven't practiced and rehearsed them. So there's some differences to pay attention to in terms of the travel EAPs, but then also the venue EAPs. We'll go through those a little bit. And then the last piece is kind of miscellaneous factors. There's all kinds of weird things that happen with travel, things that you can or cannot plan for, things that you can't predict. Everything seems it's like Murphy's Law. Anything that can go wrong will go wrong when you're traveling. So just kind of preparing for as much as you can and planning ahead for contingencies. So for the legislation, the biggest difference that I was able to kind of think of on my own or find with a brief review of the internet information that's available, sutures and dry needling are two big practices for athletic trainers that are gray areas. The dry needling in particular is banned in several states, so they don't allow the practice at all. I actually knew there was an AT with the academy in one of the MLS Next clubs, and they were practicing dry needling despite being told not to, and so they ended up getting fired for that. So being mindful of the different practices. If you fall in love with dry needling as a treatment and you go to a state where you're not allowed to practice it, that's definitely going to make things tricky. Sutures is another one where some states allow it for ATs. Some require like direct standing orders from the team physician in order to practice them. But again, if you're traveling and you're going across state borders, being aware of what you can and cannot do with sutures. BFR, I didn't know was a protected practice, but it does have some regulations state to state. Joint reductions, so things like dislocations, what you are or are not allowed to reduce. And then lastly, imaging. I've never heard of this before, but apparently some states allow ATs to directly refer for imaging, whereas most places will require the chain of command. So AT refers to the team physician, and then the physician is the one that's ordering those images. But apparently there are some states that allow ATs discretion to order imaging. Internationally, things to be mindful of, OTC medications. We'll go through this a little bit later. But one of the kind of more modern cases, there was a tennis player who tested positive for a steroid, a banned steroid. And what it was tracked down to was his medical provider was doing some kind of a massage treatment that had that topical ointment with it. And that apparently crossed into the blood. And then I guess he had a wound or some kind of a cut, and then it crossed into the blood, and then he failed the drug test for it. So he had a couple of months suspension due to testing positive for that. Completely legal drug in Italy, which is where he was from, but obviously viewed differently internationally. So being mindful of those different over-the-counter medications, and then definitely the prescriptions. Certain countries are going to ban different prescriptions, especially some of these international soccer guys. You can get some interesting preferences for different medications. So if they cross into a different country, but they have a preference for historically, they've had good results with some kind of a prescription medication, and then they want to continue that, you might have some difficulty getting that medication into your country. And then lastly, required vaccinations. So being mindful of things like immunizations, especially if you're going into a country that is known for things like malaria. What's the other one? There's some different viruses that are in some of these more impoverished countries. But being mindful if you're going to those places, checking with things like the CDC, checking with your team doctor, anything that you need to kind of prepare for in advance. Any questions, comments so far? Anybody have some fun stories with travel with any of those things?
Sorry. Some of the modalities that I'll travel with sometimes in the States, I've not traveled with internationally, namely the laser.
Mm-hmm.
So I wouldn't travel with it to Europe anyways, just from the sort of the rough trip that is on a unit like that. But even going to Canada, I left it here for the potential complications of bringing that in.
Mm-hmm. Yeah, definitely a pricey machine. You don't want anything happening to that on the road. What about things like, do you guys travel with like a Curemedics, shockwave therapy or anything like that? No?
We don't, because we have one unit, and with that, it will leave it at home out of courtesy for the other sport that I share a training room with.
Mm-hmm.
But when we travel like that for extended periods of time, just being mindful of the volume of things that I'm taking, and then going through customs and things like that, I trim down quite a bit what I take and try to eliminate anything that could be viewed as, against their, national law or regulation, even as simple as like iontophoresis. I don't take that. So, and I don't have the literature to say I can't take the laser to Canada. And I really took that based on the advice of our sales rep, who in turn can't or doesn't. So I've leaned on him for that.
Mm-hmm.
But
yeah, Ionto for sure would be a dodgy one where you could definitely catch some grief at the customs when you get there. Again, another one where it's a topical treatment, you're probably going to be okay, but is it worth the risk? Probably not. So, in the case of Ionto, let's just roll with that for a bit. If you had a need for it, would you just purchase it once you get there?
It depends. Having traveled, which I'm sure you probably both have, is that there's so many different types of pharmacies depending on the country that you're in, and some of the things that you can get are a little bit, I don't want to say better, but different. But and I'll use this as an example, is in France you can buy these 400 milligram ibuprofens, which, I mean, obviously it's the equivalent to taking a pack that we might have here in our training room, but it's reacted to differently. I don't know why. But for those, and there's other types of topicals that they have over there that I might use. But as it relates to Ionto, we're never gone for greater than 10 days to 2 weeks. So what I'll try to do is I'll try to front load treatments to just try to maximize how good they feel before we go. And I just take as many types of, manual therapeutic devices to try to compensate. I don't have any trouble taking stems, so I take those. But I just try to front load the trip to get them feeling as good as I possibly can.
Yeah, that's definitely a good shout in terms of kind of the weeks or the months leading up to that international travel, especially if those are like you said, 10-day trips, you definitely could have some fatigue going on there. You could have some more acute or subacute injuries that are still lingering into that trip. So getting those guys feeling good leading up to it is a good shout. For the resources, so depending on your individual setting, you may or may not have team physicians present. In some cases, like you said earlier with soccer, you're going to have maybe even 2 or 3 physicians present. So you'll have like a VMD, venue medical director, and then you're going to have some kind of an orthopedic specialist that's involved. That would be common in like an American football as well, where you're going to have multiple specialists that are going to be present depending on what the need is. Then you refer to that individual. But when you're on the road, you're probably not going to travel with that full staff. You might take 1 or 2, but it's definitely not the same as when you host. So preparing ahead, planning ahead, what resources are being provided by the host team? Are they going to have an ortho present? Are they going to have obviously they're required by most leagues to have the VMD, but what other resources are they going to have? We had an interesting one last year where we had a fifth met fracture, and it wasn't obvious, but it was kind of enough to kind of raise an eyebrow and be suspicious of. And the physician was just some kind of a gen med physician and wasn't great orthopedically. It was like, oh yeah, it looks okay. Like, go ahead and let him walk and just get to the airport, get it checked out when you get back. It's like, okay, well, no, let's get like crutches and a boot if we can get one. So just being mindful that not every physician is created equal. And sometimes it's nice to be able to lean on your team physicians, but other times that creates that dependency where travel can create some of those complications. Fewer ATs present. So if you're used to having a team of 3 or 4 with different delegations, if you've got roles and responsibilities that are clearly laid out for match day, and then those roles have to change, people have to absorb new roles, or if you're the only one traveling, then you have to absorb all of the roles and responsibilities there. So definitely puts more on people's plate. But then the other thing to be mindful of is the communication and how are people going to know what roles they're responsible for. For imaging, things like follow-up care, if you've got some kind of an x-ray case where you need to get that image as soon as possible, things to consider would be who's going to transport that athlete, who's going to go with them. If you're only traveling with 1 AT, then that can be problematic because you can't leave the venue until the game's over. And then even if you do, somebody has to stick with the rest of the team. Somebody has to be providing care post-match, things like that. So sometimes it's sending an assistant coach. Sometimes it's going to be an EMS transport, depending on what the circumstances are. So being mindful of the limitations when you only travel with 1 or a couple of medical staff. Resource-wise, you don't have the same athletic training room to depend on. A lot of times you'll get like a locker room set up, or you'll get some kind of a hallway set up. And so if you've got less resources set up in that athletic training room, then you've got less things to depend on if something goes wrong. So if you come back in at halftime and you need to change things around, you need to get something looked at, you've definitely got less things that at your disposal. So like Dave touched on earlier, more manual in terms of treatment. You're going to have a lot less of the modalities. So that's one of the points that I was making is, what are you going to travel with? Probably only the necessities. So being good with your hands is critical there. And then lastly would be the emergency equipment. So traveling with things like crutches, traveling with things like splints, AED. These things are annoying. They're a hassle because you have to pack them and you have to be responsible for them. In terms of an AED, like we typically travel with the AED on the bus and on the plane as one of our overhead items. So if something happens on the plane, we've got it right there with us. If something happens on the bus, we've got it right there with us. But if you're in a smaller organization with less funding, they're going to see that as an extra checked item, and they're going to get mad at you saying, why do we have to take this? So depending on your individual circumstances, which organization you're with, that may or may not be a problem. But if you're not taking these items, then what are you going to do when these emergencies pop up? Any questions, comments, cool stories?
Yeah, I have a quick question. You had mentioned earlier when you have 3 or 4 athletic trainers, you can kind of split the responsibilities amongst yourselves. So I'm curious as to how, if you're running it a one-man show, how you handle all of that on yourself, and what different strategies you have for managing that.
I'll give my 2 cents, and then Dave, if you want to follow up. It's just a matter of planning for me, and just making sure that you're knowing what roles and responsibilities you're absorbing. So, if, for example, one person is normally the primary responder, and then the other person is watching for hand signals in terms of things you might need, splints or stretcher crew, a wheelchair, things like that, they would typically be the one that is arriving with those different things. Whereas if you're the only one planning ahead, you can say, okay, well, if you see this hand signal, then the assistant coach is going to be the one to bring this item out to me. So you can get, or maybe it's a strength and conditioning coach if you have that. So getting some other support staff involved, you can kind of delegate non-medical responsibilities, things that anybody can do. Calling 911, for example, would be typically a medical responsibility. But if you've only got one person and they're providing chest compressions, they're not going to be on the phone and saying, hey, I'm doing CPR right now. So delegate the call to somebody else, but making sure that they are fully aware. What's the address of the venue you're at? What's the phone number for the contact person when the EMS gets there? What's their location for when the EMS gets there? Things like that. So it's a lot of preparation ahead of time to set yourself up for success when you get there. Dave, anything you want to add to that, or maybe I said something silly?
No, you're right. And you just, with fewer hands, you have to completely change your entire, process. So, depending on, there's less care provided depending on the scenario, but you just have to prepare. But typically in those scenarios, you started out as the only person. You are the only person. You're going to remain, versus like you started out with a team, you relied on a team, and then the team is now no more. So it's not as hard a process because there's really been no change. So, it's how did you set up? How did you have, we call them medical timeouts. How do you discuss your medical timeout? What information to get ahead of time? All that. It's really important. But yeah, it's just, sometimes it's a little bit easier depending on how you look at it, because you don't have to disseminate as much information because it's just you. So you know exactly what your role is and what needs to be done. And so it always would be great to have more hands, but there is kind of a give and take. Uniquely, talking about travel concerns and issues, is that every time I've traveled internationally, it's always been a difficult thing to get the AED through customs. And but I've had some unique situations on the road now, things I never thought I'd deal with. And it's provoking. I mean, it's thought provoking, which is why I'm going to share it. One, we were in France in a gym that was really, really hot. And if you've been over there in the summer, there's no air conditioning whatsoever. And there was one door. And so it was incredibly hot. And we weren't playing a high-level local team, so it just wasn't a great accommodation. Well, somebody started seizing in the stands. And looking around, I did as much as I could to get any kind of information ahead of time, but sometimes on these foreign tours, there's no information to get. So as far as at that moment, I was the only medical provider in the gym. And thankfully we were in France, and I had some semblance of broken French. But until 911 got there, it was me. And thankfully it was just a basic seizure, so it didn't have any other complications. You always look for airway, breathing, circulation, things all those were fine. So you had to let it kind of go its course, but I had to kind of control the scene, which was relatively chaotic. So that was interesting. Hopefully never experience that again, but that still changes some of my things and like how I stock my kits, which I'm pretty good on compartmentalization, but I'm not as good as I thought I was, because when I would ask for certain things from some of my staff, they still didn't know where to grab it. So mine is even more simplified. And then another thing is we were flying back and this is know your travel party type of a thing. So we were not on commercial flight, so it made it simpler. But we were flying back from New York, and we may have taken off at 1 a.m. Eastern time, so really late. And I had fallen asleep probably a couple hours in, and they wake me up to say somebody's having an issue, and they don't know that somebody's just not acting right. And I go over to the person, and it was a non-staff member. So it was not a player, it wasn't a staff member, but sometimes we'll have other people on trips with us. Thankfully, though, I knew this person relatively well, and I knew that they were a diabetic. They were unconscious and unresponsive, and it was in the middle of the night, so no one really knows for how long. So I say that to say what a blessing and a miracle is that not only do I have a diabetic on my team that season, we also have a diabetic in our Bear Vision, but our video graphics department that always travels with us. So I had plenty of materials, but it was like I said, it was a miracle and a blessing that we did, because this person had nothing, and it was my first opportunity to use a glucagon nasal spray versus doing injectable glucagon or trying to put something in a unconscious, unresponsive person's mouth, which is always touchy. But and it worked like a charm. So I honestly, forever from now, unless something better comes out, if I have a diabetic athlete or if I know I'm traveling with diabetics, I'm always going to have that, because it was a miracle. But you just never know. So unique travel experiences.
Yeah, those are definitely two cool stories. Couple comments in response to them. One is definitely Murphy's Law applies there. Things that you are never going to plan ahead for. One, it's a non-athlete, it's a non-staff member. You're not even conceptualizing them on your travel party, let alone planning ahead for what kind of medical conditions that they're going to have. So really lucky that those that the athlete had the supplies with them. And then two, the checklist
so
on the
I'll
right.
say I don't want to make myself look too terrible. I always carry supplies because of my athletes. So I like having double the amount always on the, just in case that my athlete doesn't leave them. So I was prepared. I just was not prepared for a non-player, non-staff member on the trip.
Right. Yeah. The checklist on the right, I don't know if you guys can see this or not. It's pretty small because it's such a massive, it's like a whole page out of the textbook that I selected for this week. But it's a team physician resources or materials supplies checklist. So definitely an interesting item to have kind of on hand. I tend to be a pretty forgetful person, so I'll think that I have everything, and then I'll go through a list, and then I've got like 6 more things that I completely just like brain fart forgot about. So things like this are really helpful for me. So feel free to adapt if you want to steal this one directly. I can send a larger copy of it, but any kind of a travel checklist where you're planning ahead for these kind of things, making sure that either you or your physician has especially the emergency equipment that's necessary for those acute emergencies, things that are diabetic emergencies, asthma, allergic reactions, things like that. Cardiac's obviously on everybody's radar, but the smaller things that somebody might miss. For the EAPs, so the travel specific, this would tie into some of the stories. So having an emergency action plan, not only for the venue when you get there or for the hotel when you get there, but the bus and the plane. What kind of checkpoints do you have along the way? If you've got a long bus ride, what's the cities along the way to have some kind of a stop if you need it? Who's gonna go with them if you have to have them separate from the rest of the bus? On the plane, where are they going to land short somewhere, or are they going to wait until the end of the flight? Knowing what personnel you have with you. So we are blessed that we usually travel with our physician. So our physician would handle most of those things. But if you're the only one, being aware that you might have to be providing things that are probably a stretch beyond your scope of practice if you're trying to save their life. There's all kinds of things that are not within our scope of practice that we would probably do. I know tourniquets are kind of a gray area. A lot of people are pretty scared of tourniquets, but if I have to choose between my scope of practice and saving somebody's life, I'm probably going to err on the side of saving somebody's life. So having plans in place for bus, plane, and hotel, I think is one that people forget about a lot. So knowing what's around the hotel, knowing where the nearest hospital is, not only to the venue but to the hotel, so that if something happens while you're staying there for the night, you've got plans in place to get that taken care of. Venue specific, touched on this a bit earlier, but the lack of practice. So everybody runs through their home EAP once or several times a year. And so when you're going to some place for the first time, yeah, they're going to go through those medical timeouts, but you don't have the same practice. You don't have the same comfortability of just kind of muscle memory at that point where you're just going through the actions. You've really got to be aware of what those pieces of information that you need are and getting the stakeholders involved that need to be involved. For the other piece of that is the unfamiliarity. So you don't know the hospital system. You don't know which physicians to call and to refer to. You don't know the pharmacies of, like you were saying earlier, Dave, the quality of the medications that you might get, especially in the cases of an international travel. But even within the US, some of these pharmacies might be just really small town pharmacies, and you don't have everything that you would in a bigger city. Miscellaneous factors. So altitude is a big one. Swelling and circulation problems can definitely be problematic. A lot of teams are now traveling with compression tights for this reason. One of the suggestions in the paper is to just have athletes stand up. Not only athletes, but your staff, especially if they're elderly staff, making sure that they're adjusting their position frequently. The paper suggested at least hourly standing up, stretching, walking up and down the aisle a bit, preventing things like DVT, blood clotting, anything like that. And that's a big problem with the NBA currently, as much as they travel. I'm sure some of these guys fall asleep sitting upright and all that blood is just pooling in their lower legs. So things like Firefly are pretty popular, getting some of that muscle contraction, getting some circulation pumping while not even paying attention to it. I think that's probably the biggest advantage of that product. I'm not a huge proponent of it for recovery purposes, but for travel specifically, I think it's a pretty good invention. Jet lag is definitely problematic for all teams that are crossing time zones. This can be more problematic if you're traveling internationally, going to Europe, for example, but even within the US, if you're crossing from East Coast to West Coast or vice versa, 3 time zone changes can definitely be problematic. The paper later talks about needing a half day to a full day per time zone change to recover. So if you're crossing 3 time zones, I mean, you might need a day and a half or up to 3 days to fully get acclimatized to that new time zone. So they provided some suggestions to manage that we'll go into later. Acclimatization is definitely a big one. If you're going from a cold environment to a hot one or vice versa, having enough gear to stay warm. Definitely weather safety, but then also the altitude, the humidity, the air quality are all things that are playing into it. So looking ahead in your schedule and seeing where you're going so that you can plan ahead for some of those things, making sure that you have cold gear, making sure that you're preparing ice baths or hydration, things like that when it's a bit hotter or humider. And then lastly, for the international travel, food and water safety is a big one. At the MLS medical symposium, there was a presentation on international travel. I believe it was Columbus that went to, I won't remember which team they went and played, but it was in the CONCACAF Champions League, and they were playing in Mexico somewhere. And they told the story that they all got traveler's diarrhea. Their whole team, I think -2, had like really bad diarrhea for the day before match day -1 and during the match day. So something to be aware of is food and water safety. Any comments, questions, concerns? Cool. So for the literature review, the two that are provided by the NATA that I thought were pretty fascinating. The one is the Sports Medicine Licensure Clarity Act, and that was passed, I believe, in 2018. And so this gave a lot of relief to athletic trainers across the country. So crossing state lines, not knowing whether or not your athletic training licensure still applies, was a big concern up until this act was passed. So the passing of this act helps athletic trainers to have less fear and hesitation when practicing typical routine athletic training practices when they're traveling interstate. The visiting team is a kind of a checklist or a to-do list of what you should be providing to the visiting team if you are a host, and things that you can give them ahead of time to help them prepare. Jannik Sinner is the tennis player, and then I'm going to butcher this name. Trophodermin is the topical, I believe it was a corticosteroid. Could have just been a steroid. I don't remember exactly where the classification was, but it's a banned medication in the international drug. What is that? ISSF, I believe. But basically, it's the sport regulatory agency, and it could have been USADA, actually. I'm not sure. But he failed the drug test and had to serve a suspension because his medical provider was giving him something that was banned. So interesting, just being mindful of those kind of international regulations. A couple of media reviews. So the first link is Tyler Lesher. He works at UCLA, and he's got a YouTube video where he's packing for a road trip. It shows kind of all the different things that he's packing, both in terms of first aid supplies, but then also the modalities for recovery. Similar to you, Dave, he's packing tons of manual stuff. He's got a lot of like cupping, different instrument assisted soft tissue mobilization stuff. So pretty fascinating to see all the different types of things that he's packing for just a 1-game road trip. And then the second video is it's a little bit bigger. It's not necessarily just travel, but it's the New England Patriots, how athletic trainers are preparing the team for the game day. And part of it was showing kind of the hotel setup and how they're trying to replicate their typical athletic training room procedures so that the team has everything that they need on an away trip. So good video to watch there. That brings us to the publication review. And so again, this is a bit hard topic to find high quality clinical evidence. So the best thing that I could find in the literature was a textbook chapter, and this was provided as an expert opinion out of the Clinical Sports Medicine, Medical Management, and Rehabilitation textbook. So lower quality evidence, but still better than nothing if you're trying to base your best practices. Some of the things that they were discussing in this the chapter was the preparation piece. So familiarize yourself with the location. Again, if you're going to be staying at a hotel, what's around it? What kind of resources do you have? Are you going to be bringing some of these emergency supplies to the hotel? If so, where are they going to be stored? Making sure that everybody knows where to access them if they need them. Communicating needs. For example, Dave, if you're the only one traveling, who's in charge of medical responsibility if something happens to you? So communicating those things ahead of time. Who's gonna be the backup plan? Things like insurance. Does that cross over internationally? Talking with some kind of a host, whoever's bringing you guys into that international travel. Are you going to have safe access to food and water, bottled water specifically? Venue-wise, what are you going to have access to? Is it an athletic training room? Is it a locker room? Is it just a hallway? Is it just the court? What do you have access to? Vaccinations. Are you going to an international country where you have to prepare ahead of time and you have to get these vaccines before you travel? If so, are you coordinating with your team physician to get that taken care of? Basically tee everything up, make it easy for your athletes, make it easy for your coaches, and everything should go smooth, except for we know that it won't. Nutrition wise, so they talk a lot about the bottled water aspect. If you have some kind of a bacteria or a virus parasite inside of the water that's coming out of the sink, anything it touches is now contaminated. So that goes for raw fruits and vegetables. If you're just thinking, oh, I'm just washing my fruits and vegetables, big thing that's talked about with Americans who travel is brushing your teeth. use a bottle to brush your teeth. Do not brush your teeth with the running sink water because you will get sick. It gives suggestions for how you can decontaminate these water sources if you are in a pinch, but bottled water is by far the easiest option there. Boiling them or filtering them can work, but being mindful that if you're boiling and filtering the water or have bottled water and you're trying to put it on ice cubes to make it colder, the ice cubes came from the same infected water source. So that is a big no-no. Illness-wise, this is kind of common sense now after COVID, but if you've got any kind of a bacterial or viral infection that's going to be going around, specifically upper respiratory infections that's going to be spreading through your team like wildfire, isolate the first case as soon as you see it. Masks use can help if you're in confined spaces, but isolation is ideal. So getting them over-the-counter medications, if it's a viral infection, will definitely help mask the symptoms, but it's not going to make the infection any less communicable. If it's a bacterial infection, getting them some antibiotics is definitely recommended. If it is a foodborne pathogen, so prevention is key here, because once you have it, you're not getting rid of it until you're getting antibiotics or antiviral, or you're getting some kind of anti-diarrheal medication, IV fluids if it's a really bad dehydration case. And then if you're dehydrated from throwing up, from diarrhea, obviously getting them some kind of an electrolyte formula, tablets, or sports drink to rehydrate. And then for my last pun of the night, flight school. So things, tips and tricks for once you're actually on the plane. So jet lag, exposure to sunlight on the natural circadian rhythm. So once you get there, follow whatever that sunlight pattern is. If you get there and it's dark out, go to sleep. If you get there and it's light out, stay awake, do your normal routine. There's been pretty good evidence. That's pretty consistent finding with travel research is as soon as you can get your circadian rhythm aligned with the sunlight, then the quicker you're going to adjust to those things, the less performance drop off you're going to have. Oral melatonin has been shown to be effective to reduce jet lag. So if anybody's a fan of oral melatonin, they can take that right before they go to sleep. Avoid diphenhydramine because this can be a longer lasting medication, and they can kind of get like a hangover type feeling when they wake up. So some of those more sedatives, stronger sedatives can linger into the morning, which can then have performance deficits. And then, like I said earlier, change positions hourly when you're actually on the plane. Stand up, walk around, stretch. All of those things are going to help with DVT or blood clots. Any comments, questions, concerns after that quick literature review?
We did some things differently, and it goes back to COVID. And I think it was out of the box for us, but we just needed to develop a plan. But during COVID, there was always the discussion on, in the event that if you had somebody test positive while you were gone, what are you going to do with them? You can't fly them back on the team plane. You sure as heck can't fly them back commercially. So what we did is we just went ahead and developed like a game plan and had it set up to where we would use an air ambulance, which there's a lot out there. So it's not like you're taking something from someone that really needs it and putting a relatively healthy person ahead of them. But using something like that had the safeguards in place to be able to transport somebody like that. And even though that was 4 years ago, I bring it up in the fact that even though some things are really difficult, there's unique solutions to a lot of different things. You just have to have, an understanding and hopefully some level of exposure to know those things exist. And even now, that's something that's in my back pocket if we have some sort of a significant travel consideration in some way or another, and you run into a roadblock. But it's just kind of unique. But with planning and preparation, we had a number just ready to go for that. And then also unique to us when we travel internationally, regardless of where it is, our school, basically, if there's a member of our school, whether it be a student athlete or a staff member, if they go to another country, we are then monitored. Not like our phones are tracked or things like that, but they know exactly where we are based on our trip itinerary, to where if ever there were something that were to occur, then they would be quick ready to be able to help us problem solve if there's a crisis in another country, which has been utilized, not by us, thankfully, but by some of our various groups that have gone on mission trips or things like that. And it's been very helpful.
Definitely cool stories again. You are definitely a wealth of information, so thank you for sharing those. I think the general gist of COVID is that it made all of us very annoyed with the practices, but at the same time, it made us all better clinicians, especially when it came to communicable diseases, planning ahead, looking at the different travel aspects, things like that. So I think as much of a pain as COVID was and as much disruption as it caused, I think it definitely made us step up our game, and some of these countries were much better prepared to handle them. I know Japan culturally is very disrespectful if you have some kind of a sniffle and you're going to work, or if you're going to some kind of a social event, whereas that's definitely not the norm in the US, where if you just have a sniffle, that's it. Oh, how dare you take the day off? So I think in some regard, it made us catch up to some of those best practices. So yeah, thanks again for sharing those stories. That wraps up the night for us. So just to go over a quick summary, the legislation, being mindful of both interstate and international travel, planning ahead, looking ahead, and communicating with the different stakeholders that can help you out there, getting the team physician involved in any kind of a medication case, planning ahead with any kind of host, whoever is the contact point there, to make sure that you have things like bottled water, enough safe food that's being prepared with bottled water, not with the running water, making sure that even the chef is washing their hands with bottled water, not with the running water. Simple overlooks like that. Oversights can cause massive issues for the team when you're traveling internationally. Being mindful of the resources that you do or do not have, planning ahead. So if you're the only staff member, making sure that you're delegating appropriately, you're communicating what your needs are, but then also where things are. If you're pulling in some new help, where they can find the things that you're going to need. Equipment wise, taking what you need, but not packing too much. We talked about obviously getting the AED through customs can be a pain in the butt, but you can't not travel with an AED. So that's probably one that you have to just bite the bullet for. EAP wise, planning ahead not only for the venue that you're going to be visiting, but also the travel on the way there, the bus, the plane. Talked about a couple different issues you could run into, things that you should be prepared for to deal with in any time of day. That could be 1 a.m. when you're on a plane, or it could be midday, mid game, something where you're more prepared for it. So just being mindful that emergency can happen anywhere. And then the last thing was the miscellaneous factors. So planning ahead for the different travel complications of actually flying long duration. So that wraps up this week and this month for acute injuries. So next week, we'll get into one of my favorite topics, which is performance enhancement as a medical professional. And specifically, we're going to be talking about speed development. Thank you both for joining, and thank you both for sharing comments, questions, and cool stories. Really appreciate you guys being here.